When it comes to GBS, are there any specific tests involved to clinically diagnose that a patient is suffering from Guillain-Barré syndrome?
Yeah. As I have mentioned, the GBS is the clinical entity. Based on the history, what is being given by the patient, and then the examination will come to know that patient is having a GBS, and we immediately start them on some kind of a medications, what I have mentioned as the IVIG, or else it could be a plasma filtration. Other than this, to evaluate more or else to make sure that he is having a GBS, it is always advisable to do the nerve conduction test, which we are going to discuss. And other than this, there is something called as a lumbar puncture, where the needle will be inserted through our spine, and it is totally a safe procedure. It is having a very less pain. Now this test will be, by doing this test, will assess the cerebrospinal fluid, which is the brain fluid running through our spinal cord. Now it is also the test which can give us the idea that patient is having a some kind of a
this is only for GBS.
Yes, this is for the, I mean, usually the test will be kind of if two things we can make out, like whether the patient is having some kind of a infection or else it is something else. In case of a GBS, yes, there will not be any kind of an infection, as it is an autoimmune related process. The protein levels will be very high and then the cells will be very low. Now this is a supportive kind of a test. So nerve conduction and then the lumbar puncture test, they are necessary in patients who are having the GBS.